Hi, Dr. Andrea O'Connor here, and I've started a challenge to myself. I want to commit to trying to put out a video every day for 30 days. And my rationale for this is, I binge YouTube too. I like to see what other people are doing in their lives and what other practitioners are doing, and I kind of think it helps them make a life change. Like when they say, I'm going to run every day for 30 days, or, I'm going to not have screen time every day for 30 days. So my challenge to myself is to put out a video every day for 30 days. And my hope is that I can put out more medically related content, advice, for example, on how to run a private practice, or kind of want to do a video about running a private practice while I have another full-time job, and that'll be another video. But today I'm going to do a what's in your doctor's bag video because I think that's really fun. I love to binge watch those videos to see what people carry in their backpacks or their purse or their doctor bags, and picking up hints and little helpful tips. So I've been in private practice since 2009, and this is what I have whittled my doctor bag down to. So I'll show you the bag first. So that's just it's just a black Kate Spade bag. It's quite a few years old. Nice and roomy. I got a little brown suede on the side, and simple. I love it because it has a zippered top so nothing falls off or out. And okay, so we're gonna start. So the first thing is the Cardia Mobile. And this is the AliveCor Cardia Mobile 6-lead EKG. Now there is another one on the market that has the 2-lead EKG. So you just pop it out, snap it out. It's got the 2 metal sensors on the front, 1 metal sensor on the back. So they do a thumb, and I usually go above the ankle, but if they have range of motion issues, I believe you can go right above the knee as well. And the patient places it against the skin. You have an app on your phone, and it literally can pick up the 6-lead EKG results in about 30 seconds. And then why a 6-lead versus the 2-lead? And I believe the iWatch EKG is a 1 or 2 lead, but the 6-lead helps us differentiate not just irregular heartbeat, atrial fibrillation, but it actually increases the accuracy of rhythm determination. And depending on the electrical vector of the left and right atria, the best lead to visualize P waves varies from patient to patient, of course. So when you have 6 leads to choose from, it improves our ability to differentiate sinus rhythm versus AFib. So it's just a more exact way of determining if your patient has issues with their heart. I love this too because it is lightweight. Again, you can put it in your lab coat pocket, you can pop it in your bag, and patients really love it that you can say, oh, by the way, besides your blood pressure, let's just quick look at your EKG, and they love that. And then I go through and explain what I'm seeing here. And you can save them, and you can email or text them a screenshot of it. I recommend it, and I want to say they're still under $200. So I recommend that one. Okay, so the next thing in our bag is the Welch Allen. So this is the Otoscope and Ophthalmoscope. And I know when I graduated medical school, they gave us the big otoscope and ophthalmoscope in a big case, and it was the heavy kind. You had to plug it into a wall, and then they wouldn't take a charge, and they're really expensive. So I ran across this, and I love this because here's your otoscope, and it's got a very strong light and super lightweight. You can just pop it in your bag or hang it on your pocket. It comes with the speculums, disposable, so you can just pop one on, pop it off, throw it away. You unscrew the bottom to put the AA batteries in, and this is just great. You don't need that big clunky one. Yeah, I mean, it looks fun when you first get out of school, but you want the lightweight one you can take everywhere. Then it comes with the ophthalmoscope. The light, it's a little bit more dim, it just came on before, and that's nice too. I know it doesn't have the the rubber casing on the big one that kind of spaces you away from the patient, but it's really great. You can get close up to them. And then it goes in this cute little lightweight pouch, which again I think is really convenient to keep in your bag. Okay, so next in my bag, cell phone charger. This is the Anchor, and I love this one because it can charge your cell phone, it can charge iPad, your laptop even, and it keeps a charge forever. And again, I was skeptical getting this because I want to say this one was like $30, and you just push the button, it'll let you know what charge it has on it, and it just holds a charge for a really, really long time. So I do recommend this one. Again, here's the ports it can support. So, you know, love that one, Anchor. Okay, next one. Oh, this is simple. So this is just a CPR resuscitation mask, and I haven't had to use this one yet, thankfully. So it still has the plastic case in it. It goes over the nose and mouth. And again, I kind of think it's really great to have. I did pop this in my bag when COVID really ramped up because I thought, okay, I should just have this on me. God forbid. I don't know. Might keep me a tiny bit safer, but I already had COVID. I got over it. I was fine. I mean, and I know everyone has their own experience with it, but I still keep it with me just in case. This one is the Dr. Mom Otoscope, and you know, I picked this up on Amazon. A lot of people were raving about it, and it's okay. It's not professional grade by any means, but when you're in a pinch and you just want to shove something in your pocket, and you don't really care if you lose it, it's this one. It has a very, the light's not that bright. You can kind of see how bright the light is there. And, you know, again, you pop a speculum on it. You have your little magnifying glass. I think it's really great for maybe teaching parents how to use this and safely examine their child's ear. But I have an even better hack. This is what's next. So this, I actually learned this from a patient because she called me up with pain in her ear, and I said, I really need to see inside your ear. And so she sent me some really sharp, wonderful images, and I picked this up on Amazon based on her recommendation. So this is the brand name, Teslong. I'm not familiar with it, but this is the case. Nice hard case. And then what's inside of it? So it comes with all these cords and equipment, and it's literally, this has a little camera on the end right here, and so you can examine the inside of patients' ears, you can go up the nose, you can look down the throat. You know, I would cover this with a little saran wrap or plastic wrap just to keep it clean, because you don't want to just be putting this everywhere, and that way you can just throw the plastic bag away. It turns on, there's a little on button on the side, and then see the blue light here clicks on. Here's the light, very bright again. There's a little ring of light, and then the camera's in the center. And it gives really sharp, clear pictures of the tympanic membrane, the ear canal. I mean, you can see everything. And then it's live from the app you put on your phone, and you can take pictures. Here's the little camera. You can take still shots. But even live, while I'm doing it with the patient, you can show them on the iPhone, here's what I'm seeing, here's what's going on. I think it'd be really great for if someone comes in with a lesion on their back or a mole, and they're curious about it. And again, you can light it up and take pictures of it and show the patient what you're seeing on your phone. And, you know, I guess it could work with wound care. You know, if you're trying to get an idea what's going on, or you want to send something to a colleague, again, you just take a picture. And I know you can do that with your phone, but getting into tight spots where you really don't want to be putting your phone, I think this is really great. And again, I want to say, I think this was under $50 on Amazon. Now, I don't have any affiliate links. Never say never. If I can figure out how to do that, I'll put affiliate links so it's easy to find. But right now, I don't have any. These products I just got on Amazon, so hopefully you can find them too. Oh, the next thing out of the bag that I really like. So this is my MDF stethoscope. And I know everyone's talking about MDF stethoscopes, and there's a reason why. So when I first started healthcare years ago, I had a Littmann stethoscope because everyone said Littmann was the best. And then I graduated to the cardiac Littmann, and I think one of mine, my dog chewed it, the other one I left on a counter in the hospital, and someone picked it up, never saw it again. And I was like, great, that was $300. And so I saw a video, I don't remember who was talking about it, and so I ordered it. This thing is just as good as a Littmann, if not maybe even better. So it comes with nice, comfy, the little ear cups here. And so with your bell and diaphragm, you just twist it. And then that way you'll hear, high frequency tones on your diaphragm and the low on the bell, and very clear, sounds great, and really durable. And, I fold it up like this. It doesn't get any kinks or cracks yet in it. Every now and then, my other stethoscopes would get kinks or cracks in it. Now, Littmann is a great stethoscope. I mean, if someone gifted me a Littmann, of course I would accept it, but I've had so many walk off that I thought, okay, this was not the same price point. I want to say this was around $60, $70. So, and it is great. So if you're wondering to get an MDF, I highly recommend it. I think it works great. The next thing in the bag, manual blood pressure cuff, of course. I love using a manual blood pressure cuff because if I have a patient say, they've had high blood pressure numbers and, they had it done by a machine at another doctor's office or a clinic or an urgent care, I always recheck it with a manual. I mean, they're lightweight, they're inexpensive. You can get them anywhere from, a somewhat decent one that's going to last anywhere from $30 to $50. At Walgreens, they sell the $19 ones that the stethoscope is attached. Well, that's great in an emergency, but otherwise, just upgrade to one. I think this one is Ever Dixie. Again, I mean, not the highest of the high brand, but this one works. I recommend carrying that. And then, of course, like most people, the standard Reflex hammer. Honestly, I use this on my thyroid patients. So I use them on my hypothyroid patients, just looking for, the tone and the reflex at the lower extremities. But, that's kind of it. And then, of course, I don't know, I still carry these. Every now and then I think I'm going to have to do a Weber and Rhine test, but I don't know, maybe more for a nostalgic sense because honestly I don't have to use these often. But they're really kind of cool. The little hack is, I can't imagine when you wouldn't have access to x-ray, but if someone has a fracture, I mean, an easy way to test it, you just put this on the bone and that would really hurt. So it kind of confirms your diagnosis. And then of course we have some black pens. You gotta write everything in black, and some alcohol prep pads to keep my equipment clean and safe. And then we have, a pulse ox. So post-COVID-19, who doesn't have a pulse ox? I feel like everyone has a pulse ox now and knows what it is. So we've kind of come a long way. So easy, lightweight, got it on Amazon, very accurate. I compare it to the one on the big machines. And then I'll carry, I carry some business cards. Show you, kind of pretty. Because you never know. Having a private practice, when you're starting out, you do want to get your name out there and market. Perhaps I'll do a video on that of how to start your own private practice. There's so many pros and cons to it. I have no regrets. It's a long story. It deserves a whole nother video because I would probably talk about it for 30 minutes. So if anyone out there in internet land is watching these videos and is curious about anything about starting a small single doctor private practice, I'll make some videos about it. But otherwise, I think I'll keep doing some lifestyle videos. That might be the easiest for me to stick to my commitment. I think the next one I may do on, self-care, things like that. But, and then of course, I do carry my iPhone in my bag. I mean, you can't be without that mini computer in the bag. I find though that it's great in a pinch to look something up really quick, but I really try to keep all my screens down when I'm talking to a patient. And I know charting and all that is so time consuming, but having a private practice, I have found a very efficient way to chart and what system I use for that. And again, I can do a separate video about that. If anyone has an interest, just leave a comment below like, hey, I'd really like to know this about a private practice. And that would be really fun to do a video about that if I can help others. And I think that's it. Thank you if you stayed all the way to the end of this video, and hopefully see you for the next one.